Friends, it's not every day that you get to have a deep dive conversation with the former Deputy Prime Minister of Canada, who is such a remarkable woman and still fiercely plugged into all workings of the government. But today, we're fortunate enough to go there and to talk all things related to COVID, the world as it exists today, and how we will come out of it, and the role of government guiding us through it all. I am sure many of you are very familiar with my guest today. She is a well-known Canadian academic and politician. She served 4 terms as the Liberal MP for Edmonton Centre and was a cabinet minister in the Liberal governments of Jean Chrétien and Paul Martin, serving as Minister of Public Safety and Emergency Preparedness, Minister of Health, Minister of Justice, Minister of Natural Resources, and as the 9th Deputy Prime Minister of Canada from 2003 to 2006. She joined Bennett Jones LLP in its Edmonton office in July of 2006. In 2015, she was appointed Chancellor of Dalhousie University. She has a bachelor's degree in arts and law and a master of laws from King's College London in the United Kingdom. She was a professor of law, first at the University of New Brunswick and then at the University of Alberta Faculty of Law, where she served at various times as associate dean and as dean. She was appointed an officer of the Order of Canada for her service as a politician and law professor and for her contributions as a community volunteer. She was also appointed to the Alberta Order of Excellence. She became a director on the boards of Nexon Inc., Agrium Inc., and Camco Corporation. She is currently chair of the board of directors of Pearson College, UWC in Victoria, BC, and Pearson is one of the 18 global United World colleges in the world. Friends, I truly am honored to call her a friend, and joining me for a very candid conversation is the Honorable Anne McLellan. It is so nice to see your face on this Zoom call. Feels weird not to be in the same room as you, Anne.
But lovely to see you, and I'm happy that we can have one of our conversations.
I am so happy. The honor is mine. Anne, how are you, and how are you and your family doing in light of this whole COVID crisis?
Everybody is fine. I'm fine. I have been self-isolating and, going out when I can for a walk and things like that, but always social distancing. My stepdaughter and her husband and my 2 grandkids live in Sherwood Park, as you do.
Yes.
And they're doing fine. Jessie is a high school teacher at Beth Facey, and she's doing her classes for her students now online. And the kids, Hannah and Mason, are both at home, and they're doing some virtual learning as well. But it's, as we all know, this has been very disruptive of people's lives, and everybody's had to establish new routines, new coping mechanisms, how you keep, it's not only the kids who need to be entertained and, always dealing with boredom, but it's all of us, I think.
Yes.
I think it's very much a different situation in which we find ourselves.
Well, you mentioned it briefly before we started recording that you're not quite sure how to feel about this, because I think we all feel out of sorts because we're craving those connections with our friends and colleagues.
No, I think that's exactly right. And, I'm one of those people who, up until a few weeks ago, did not believe I was at work unless I went to work, right? I work at the law firm of Bennett Jones, and I would go, if I was in the city, I would go to work every day because that's where my office is.
Yes.
That's where I feel that that's where work gets done. And now, of course, work has to get done in my study or my family room or whatever it is. I'm learning a lot about technology, which I suppose is a good thing, especially at my age. But yeah, I am one of those people, I think very much like you. You're used to going out with friends for a drink or dinner or just getting together, going to a movie, whatever. And you know what? none of those things are being done. None of those.
Isn't it crazy?
We can't do those things. I drive by restaurants that I think, oh, I should go, blah, and no. So they're all closed. But I do encourage people to support local businesses. If they're doing delivery, I ordered from a restaurant downtown Thursday. I never seem to get my act together to get to order from Corso 32. They're always sold out by the time I remember. A little plug there for one of my favorite restaurants.
Yeah, we love them, of course.
But,
yeah.
you know, I really do. It is a very strange world, I think, for all of us, and we all have different coping mechanisms. But I do think it is important to stay in touch. And that's why, you know, over the weekend, I had 3 virtual drinks parties.
So did we. Doesn't it feel weird? But it was fun.
Was, and you see the people, you know, if you use Zoom or FaceTime or Microsoft Teams, you see the people, you can see their eyes, you can see their body language and all of that, which is great. I mean, obviously a phone is, that's fine too, but it's wonderful to be able to see people's faces. And, you know, it's going to be interesting to see how this, I think at the end of this, depending how long it lasts, how this transforms at least the way we do work.
I'm interested, but I'm not going to let you go there just yet because I want to dig into the now right now, because I really want to have your thoughts on the COVID crisis and the impact it's having on the world. I'm curious what you would compare it to, because I'm hearing from some experts, they think the impact could be worse than the Great Depression. So what perspective do you have on that, Anne?
I have read some of those pieces as well. Some people also compare it to the Spanish flu of 1918, at least in terms of the rate of infection and the loss of life. But I think we don't know, because none of us have really seen anything like this before. This is a global pandemic. Virtually every country in the world is suffering from this particular infectious disease. It's very different than SARS. When I was Minister of Health, I lived through SARS, and but SARS was geographically contained. It actually only involved, in any major way, a handful of Asian countries and, unfortunately, Canada.
Yes.
We had, I think, the 4th largest rate of infectious disease with SARS. But even in Canada, it was geographically contained in and around the GTA. So it doesn't have, SARS did not have, one, the global reach, nor did it have within our own country the reach that led to containment measures and, you know, quarantine. Quarantine was used in the GTA during SARS quite liberally to keep people at home. The rest of the country didn't really have to face that. So this, I think, is the first time that we have seen this kind of global pandemic where people are being told to stay home. With SARS, I don't know whether you remember, but we kept telling people to go out in the city of Toronto.
Yeah.
Obviously reasonable precautions, but it was largely contained to a couple of hospitals. And also quarantine was used, as I've mentioned, liberally. So people who were suspected cases actually were quarantined at home. So, you know, Prime Minister Chrétien went to a Chinese restaurant and said, I want everybody to come out and support the Chinese community during SARS. We had a cabinet meeting in Toronto. I went on the subway with my provincial counterpart. We didn't wear masks because there was no need for people to wear masks during SARS. So we were encouraging people to go out and eat out and go to the movies and support the economic activity in the GTA. Here, it's stay home. Stay home because this is a highly infectious disease. It's not as lethal as SARS, at least the rate of death is not as high at this point. But it moves very, very quickly. And in fact, part of the problem is that you can be asymptomatic and have mild symptoms and pass it on, and you don't know that, which is why
Yes.
testing is so important. So all of that to say that maybe you could compare it a little bit to H1N1 in 2009, when it also was declared as a global pandemic. But the reach was not as great with H1N1, and I think not as lethal, perhaps. So this is a new experience for almost all of us, including our elected officials and even many of our frontline first responders.
Give us some idea of the pressure that is on them and the work expectations. Like, you held so many portfolios within government and as a former deputy prime minister, but have you been in touch with Justin Trudeau, the prime minister, and have you talked with anybody in the government? I can't imagine the pressures they're feeling right now and the amount of hours they're working. Can you just give us a better understanding of that right now?
I think you're right that the pressure is enormous, and every day this is so quickly the evolution of COVID-19 has happened so quickly, and the infection spread happened so quickly that every day is different. And so you have the healthcare crisis, the pandemic crisis, but because the prescription for that is for people to stay at home, you have an economic crisis. So the government actually has to deal with both. Now, first and most importantly, they have to deal with the health crisis, because that is about keeping people well, trying to limit a serious infection, and obviously limit death. And it is also about the functioning of our healthcare system and the pressures on that system. So that has to be first and foremost. You have to, as we've heard so often, flatten the curve so that our hospitals will be able to deal with whatever surge comes. And we know that our healthcare system across the country, the various provinces, very limited surge capacity. Our hospitals are usually full, our surgeries are usually full, our emergency rooms are usually full. So there's not a lot of surge capacity, which is why you want to flatten the curve. So I think the pressure is enormous in relation to the healthcare crisis. Then you've got the economic crisis, which is, oh my gosh, all these businesses are closing. Main Street, if you like. All the small and medium-sized businesses, they don't have customers. So they lay off their workers. There's no income coming in. We know that a very large number of Canadians really live paycheck to paycheck.
Mm-hmm.
And that is pretty frightening when all of a sudden you don't have any customers in the bar or the
Agreed.
restaurant or at the manicurist, the hairdressers, whatever it may be, right? Little corner grocery stores. Therefore, the government has to deal with that economic crisis, and that's largely departments of finance, where they are thinking about how do we keep money flowing in the economy? How do we flow cash? Quite honestly, cash in the form of obviously a direct deposit most of the time, but money, liquidity, yes, to companies, but liquidity also to individuals, to the people who've been laid off. How do we get them enough resources so they can pay their rent or their mortgage and feed their kids and do those things, pay the bills? And that's why you see the Department of Finance and the government working so closely with banks, credit card companies, and others in terms of trying to make sure that we're all pulling together here and that we're putting and have access to as much liquidity in the economy as possible. And even though most of government is focused on the healthcare crisis, the Department of Finance and their people will also be looking beyond the crisis to how do we recover? What do we need to do so that after we reach the peak and we're coming down the other side and we think that people can start to go back to work and certain businesses can start to open, what do we need to be doing to make sure those businesses are in a position to open, that their workers are available to go back to work? So, the federal government is doing that. They're working very closely with the provinces and territories. I think we've probably never seen a degree of cooperation and collaboration between different levels of government, including municipalities. You may have noticed just over the past couple of days, the government of Canada has provided, I think, about $6 million to the city of Edmonton to deal with the homeless situation, because they are a particularly vulnerable population at this time. They can contract the disease, they can spread the disease, they have nowhere to, they move from shelter to shelter at night. So identifying especially vulnerable populations and figuring out what's needed for them is very important. So all three levels of government involved. And yes, I have not talked to the Prime Minister directly. I think he's got a lot more important things to do than talk to me, but but he knows that I support him and the government, as I support the Premier and the provincial government. We all need to pull together here. This isn't about partisan politics. This is about doing what we can all do in the best interests of all Canadians. But I have had the opportunity to chat with his office, to chat with other ministers' offices, our DPM, Chrystia Freeland, who's working overtime, obviously. She has to, every now and then, deal with these unusual wrinkles emanating from the United States, as we've seen just over the past couple of days. But they are all very focused. They understand this is something no government would want to deal with. Governments don't expect to deal with these kinds of global pandemics, but they prepare to deal with them. We do tabletop exercises. We do real-time exercises of one kind or another to try and be ready. We did a lot of them after 9/11. And then we did some in the lead up and during SARS. But you always hope you don't have to use what you just learned through those exercises. But yeah, the pressure will be enormous, and you want to do the best you can for the greatest number of people. But here, we also, governments have to actually change the way they do business. Governments like to take time to think about new programs.
There's no time.
There's no time, right? So you can't be perfect. And we as Canadians have to understand that whether it's a federal or a provincial or a municipal program, it probably won't be perfect, because they've had to design these programs, something that would take a year, 18 months. They are designing in a matter of days or a week and getting it up so people can apply for the benefits. So it's a big change for all of us, actually.
So much on their plate, on all of our plates. I appreciate that perspective, Anne. And I'm going to go here because I know that you'll be able to answer this. But as you can imagine, there's lots of criticism on the government, how it's handling what's going on. And I've heard and read the chatter. And some people, I'm curious about your perspective on this. Some people are saying that this is a total overreaction by health agencies and governments, because at the end of the day, it's killing our economy and it's decimating businesses. What's your thought on that?
A global pandemic is not, honestly, I'm speechless that people would say that. I am absolutely speechless. When you look at the numbers of people who are dying next door in the United States of America, where in fact they expect this week the numbers to double in the US every couple of days. The numbers of death and the numbers of infections in this country are doubling every 3 days. That is going to, unless we in fact flatten that curve, that is going to bring our healthcare system to its knees, and it will bring the economy to its knees. In the United States, what was it, last week, 6.6 million people in the US applied for unemployment insurance. I do not believe it's a number the US has seen on record, right? If you look at the UK, their prime minister is in hospital today, right? People die from this. Look at what is happening in Italy, where the death number, the number of people dying every day is in, just under 1,000. That number started to come down a bit in Italy. So there's a little glimmer of hope. The Chinese lost thousands of people to this to this disease. It is spreading so quickly around the world, and people get infected, they infect others, people are sick. Yes, sometimes, and thankfully, the symptoms are often mild. Because otherwise, Carrie, can you imagine what this would do to our hospitals?
Oh my
If
gosh.
people with mild symptoms all showed up at our hospitals or hospitals around the world.
Mm-hmm.
When you see makeshift morgues in Italy, places we've all been, in France, makeshift morgues, perhaps in the United States, because they can, in the New York, where we have all been,
Yes.
they cannot bury the bodies fast
Mm-hmm.
enough. Who are the idiots out there, Carrie, who
Oh.
think that what our governments are doing around the world is an overreaction?
Mm-hmm.
They are so disconnected from the real world that is very scary.
Mm-hmm. I think it's a lot the business owners, and they're grasping for straws and anything they can
But they're
hold
not
on
going
to.
to have customers, right? I mean, it's who, I mean, I look at myself. I think knowing the disease, how infectious it is, how quickly it travels, I would say, even though I would love to go out, I'm not going to take that risk. I'm not going to do that.
Yes.
And because I might infect other people, right? And unknowingly. So all of a sudden, you know, we all say we have a social responsibility to each other, to keep each other safe. And I guess that's the thing that bothers me, is that this is a time for us to come together. I love the Queen's message yesterday, right?
Mm-hmm.
And she remembers what it was like in the Second World War. And she remembers how the British came together to fight a common enemy. And that's what we're doing here. There's a reason, and it bothers me a little bit. I've not had to live through a major global war, thankfully. But so it bothers me a little bit when even I talk about, you know, the Canadian industrial complex going on a war-like footing. The language bothers me, but that's what's required here, because we have to figure out how we actually come through this infection, how we help people stay well, how we reach the peak of this infection, and we don't know where that is.
Yes.
And Donald Trump doesn't know where it is, and Boris Johnson doesn't know where it is. And we have to come out the other side.
Mm-hmm.
And that means we all need to pull together. And yes, it will be hard. None of us like being cooped up at home and not being able to go out and do the things we normally do. And yes, this is going to be hard for business. But
amen to that. Like, I agree 1,000,000% with everything.
Which is why governments, the federal government and provincial and territorial governments, are doing what they're doing in terms of providing the assistance that's out there. And I know for small and medium-sized business, I have heard that they would like to see more assistance for them. I mean, there are wage subsidies, but you have to have employees. And a lot of people have let employees go because their businesses are shut down. Small businesses are being innovative, but it doesn't make up for the lost income, right? It doesn't make up for, you can do delivery, but it doesn't make up for every night, you know, being open 6 nights a week and having a full restaurant. I think it will be interesting to see what government chooses to do. And when I say government, I mean at all levels, in relation to small business, small and medium-sized business going forward, because they are so important to the economic health of all our communities. And, you know, sometimes I think we focus on saving big business, right?
Yes.
And in 08, 09, the financial crisis, it was, you know, about the banks and the auto makers, and the auto parts makers, and a whole bunch of very large global entities in many cases, and how one ensured that they had liquidity and how they were able to continue to employ people and come out the other side. And that was done by, you know, the globe, countries around the world working
Mm-hmm.
together. I would say led by the United States, but everybody working together, understanding the nature of the problem. That's what has to happen here. Unfortunately, global leadership is not as strong as it was in 08, 09, either with the financial crisis or H1N1. You know, this is serious. We do not, if you look at projected numbers in the United States, it's staggering in the world's most developed nation, world's superpower,
Yes.
with the world's finest public health facility, the CDC, and they are looking at over 100,000 deaths. The best scenario, I think, this morning is over 100,000 Americans will die.
Mm-hmm.
Look at how many people are dying in New York every day.
Yeah.
Look at the strain on the healthcare system in America. It is legitimate, I think, to ask the question when you look at some of these pictures, what will be left?
So on that note, then, I mean, who's going to survive this and how?
Well, I think it's not possible to say that. I mean, we do know that there are companies providing services that are going to do very well in
Mm-hmm.
this, right? I mean, we know that grocery stores and producers, you know, the 3Ms of this world, who produce all sorts of products, but personal protective gear and other things. We know that the personal hygiene companies will do Procter's & Gamble, Johnson & Johnson's. They are going to come out of this just fine. You know, the Walmarts hiring 10,000 people in Canada. Right? Because they can't keep up with demand. Mm-hmm. Are they the highest paying jobs at Walmart or at London Drugs or wherever who are hiring? No, but they're good jobs, and a lot of smart employers are topping up those hourly wages because they know how important those people are in terms of providing those essential goods and, in some cases, services to people. So they're, as with every tragedy or every human created disaster or natural disaster, there are winners and there are losers. Mm-hmm. And it's hard to predict who will, although we're starting to see, I think, who some of the winners will be and who some of the losers will be, although it will depend how long this crisis lasts. Mm-hmm. And again, you know, to the people who say this, who are angry, who are frustrated, it is actually all up to us. If we social distance, if we do what we're being asked to do, stay home, wash our hands, and so on, we will get through this a lot faster. And those shops and businesses will be able to reopen. The longer they're closed, the less likely it is they will reopen. Their employees will go somewhere else if that's available, right? And it will be. We know that there will be jobs after this. But people may lose valued and skilled employees to other employers. Sure. So it's not possible to say what this will look like and who all the winners and the losers will be. But, and it is tragic, but there will be companies that do not reopen. And they will come in all sizes. But there's no question that, you know, we want, that's why the governments at all levels are working so hard together to try and get liquidity into the system so that businesses at least have a chance. People aren't foreclosing on their loans or their mortgages or demanding rent, that people get a breathing space, even if they're not in business at this very moment. They do, at least some of the monthly bills are taken off their backs. So and important. People get some breathing room so that they have a chance to come back whenever that time is.
But you know, Anne, the reality is this virus could be in our lives for the next few years because it's
Mhm.
mutating, and some experts say we need to actually get it to develop immunity to it.
Yep.
The strong can do that. So we're going to have to evolve over time. But what does our new normal look like post COVID-19 global pandemic?
Look, I wish I knew. If I don't have a crystal ball,
I
I wish
thought you
I
did,
knew.
Anne.
No, I wish I knew. But in terms of COVID-19, I have no doubt there will be a vaccine. Right? It is possible that COVID-19 will like influenza re-emerge in the winter or maybe
Yes.
spring or whatever. But we hope to have a vaccine or potentially more than one that is effective in the next year to 18 months. These vaccine developments do not happen overnight, obviously, but here at the University of Alberta, the School of Virology, they're doing a lot, Dr. Lauren Terrell and others, Michael Houghton, they are doing world-class work in terms of vaccines. They've turned, as I understand it, part of they were researching in other areas. They've turned their attention to the possibility of developing a vaccine for COVID-19, as are other university research labs, not only here in Canada, but obviously around the world. So we're hoping for a vaccine. But you know, and yes, you can develop what we call herd immunity. If enough people are infected, and in fact develop an immunity, then the
Yes.
disease actually dies out naturally. But of course, you may remember that was the strategy of Boris Johnson up until somebody pointed out how many people would die,
Yes.
and that became politically unacceptable, and he decided that he was going to change that strategy. So, you know, I think, and I have to say this as well. We have to learn from each one of these crises. We have to learn. There's a reason why we did lessons learned after SARS, right? And we implemented as governments a lot of those lessons in terms of that. And that was not a global pandemic. That was a global infectious disease, but it had not reached the level of pandemic.
Mm-hmm.
This is a pandemic. So the lessons learned from this will be implemented to make the system stronger, not only here in Canada, but around the world. You know, I hate to say this, but there will be another pandemic. It's not if, it's just a question of when.
Yes.
And the world has to be prepared for that.
Mm-hmm.
And we have to be always learning those lessons and heightening our level of preparation so that we can keep people as safe as possible for as long as possible. What the world looks like, well, it's interesting. You know, the Chinese are starting to ramp up again, although it's interesting. Here's another, you know, thing people need to keep in mind. When people say, well, why do we have to do this? And are we doing it for too long?
Mm-hmm.
The thing we learned with SARS, we thought that we had beaten SARS. We thought we had it contained in roughly 2 hospitals in the city of Toronto. Then I wouldn't say anybody took their eye off the ball, but we started to see people coming out of quarantine and people, you know, going back into emergency rooms in hospitals with various kinds of symptoms. Some of the hospital personnel stopped wearing all the PPE gear that they needed, right? Because I can assure you those masks are not nice. Those N95s are not nice to wear.
They're
in a
tight,
12-hour shift.
right? Yeah.
And they're sweaty and hot. I remember me going to visit the nurses on one of their shifts in Scarborough General Hospital during SARS. And I said to the nurses, what is the worst thing that you deal with every day? And other than being separated from their kids because they were self-isolating, it was wearing the masks. They said, you have no idea. 12 hours, most, you know, wearing that mask, you have no idea what that's like. But all that I'm not sure exactly how I got off on that tangent, Carrie.
you,
But
you were talking about how the Chinese are slowly starting
yes,
up
they're
business.
slowly
Yeah.
ramping up. But you see what's happened? They are now starting to think they're going to have a phase 2 if they don't have it already. So they have closed their borders to foreign travelers, because what they have noticed is that phase 2, if we want to call it that, it looks like it is all coming from people who have traveled abroad and are returning to China or visiting China. And the first phase 1 was, of course, domestic. It came from, as far as we can tell, wet markets in Wuhan. But this phase 2, it seems to be coming from travelers. So they took their eye off the ball, right? And that's not a criticism, right? They think, okay, the worst is over. And you start to let up because you want your citizens to be released from home. You want your citizens to be able to go to the grocery stores and walk in the parks and things like that. But you've got to be really careful that you don't do it too soon, because if you do, you may end up with a phase 2. And we discovered with SARS that phase 2 was actually worse than phase 1.
Oh boy. Okay, so I'm curious now about the world's, what you think of the response of Canada's response to this compared to the American response. Can you give us some perspective there? Don't hold back, Anne. I know you want to talk about this.
Well, first of all, let me say that the world is used to the United States of America not only being what I call a practical leader in terms of delivering the goods, either literally or figuratively, but used to America being a moral leader in the world, right? So when we were dealing with SARS, we dealt regularly with the Centers for Disease Control, the CDC in Atlanta, and they have offices and laboratories across America. They are, I would say without a doubt, except maybe for the Chinese now, the best funded, best resourced Centers for Disease Control in the world. Outstanding researchers, laboratory services, stockpiles, and so on. And I had the opportunity to visit there a couple of times during both after 9/11 and then during SARS. So you are used to America stepping up, right?
Yes.
And in a situation like this, they would be leading the charge, supporting the WHO, making sure that if they had supplies they could share, they would be sharing them. And they are doing some. I'm not suggesting the CDC isn't doing this. It's just that they don't seem to be as present as they have been in other situations. You would have the President of the United States reaching out to the leaders of other countries to see how he could help them. And it wasn't only out of altruism, it was because American presidents know that we're only as strong as the weakest link when it's an infectious disease, right? So let's see what we can do to help the rest of the world, because that's not only helping them, it's keeping America safe as well, right? Yes. And we don't seem to be seeing a lot of that. And last week we saw the president, and I understand you want to protect your own people first. We all do. But to suggest that 3M, which is a very highly integrated company, not only in North America, but globally in the production of many things, including PPE, to suggest that they should not be sending masks to customers in Ontario or Quebec, I think shocked every Canadian. You saw the reaction of our own Premier, Jason Kenney. He said he was insulted by the reaction of the Americans. Doug Ford, Premier of Ontario, I think you could just tell watching him in his press conference how he was angry, but there was this sense of profound disbelief and disappointment that, you know, after all these close connections and everything we've worked on together for so many decades, that this would be the response. So I think now, the government of Canada, thankfully, the Deputy Prime Minister, Chrystia Freeland, and the PM have good relations with key people in Washington, and they're working very hard to try and get some clarity around this. But I think what one sees, and it's not only with COVID, but in fact, since the time of the election of President Trump, what you have seen is a disengagement from multilateralism, a disengagement from the G7, the G20, these vehicles that stepped up, especially during the financial crisis, and worked together on a common response. In fact, doing the same thing with H1N1 and even SARS to a considerable extent, although a smaller infectious disease outbreak globally. But people working together. And here I think what, and I look, I don't even think maybe President Trump meant to create this sense globally in this situation. But I think people who are just a little off balance in terms of what to expect from the American president, and are not probably wondering what's going to happen next, right? And you know, today I think I haven't had time to read the article, but there was a piece where apparently the president was musing about putting tariffs on oil imported into the United States. Now, I presume he doesn't mean Canada, but who knows? Who knows? That's the problem. It's who knows, right? It is that unknown. It is the unpredictability. We can deal, I think most of us can take on most situations. We're resilient as countries and people, but it's the unpredictability, the uncertainty of getting up in the morning and having to face a new set of potential facts or consequences or barriers. And
or ridiculous tweets.
Well, yes. And it's that unpredictability that I think has thrown the global system off kilter just a little bit. And you don't want that during an infectious disease crisis, nor a financial meltdown such as we saw. You need everybody being able to trust each other. Trust is so important in times of crisis. And if you erode that trust, you don't have time to get it back in a crisis.
And do you think it has been eroded between Canada and America because of some of the decisions that are being made by the American president currently?
I am not in a position to say that. I mean, I think that that the relationship between Canada and the United States is so profound and so deep on so many different levels that it will withstand these unpredictable times, if you like. But I think, as I say, uncertainty in this kind of situation is not a good thing. People need to be able to trust each other and know what the likely actions of each other will be.
Right.
And so I think, but I think, for example, Chrystia Freeland and Robert Lighthizer, the trade representative, they trust each other. Doug Ford undoubtedly has relationships of trust with certain governors, for example, the governor of Michigan. I'm sure Jason Kenney has relationships of trust with certain governors. So it's not that all trust between Canada and the United States is being eroded, but I think at certain levels, it's getting harder to, with certainty, understand how people will act.
Okay, let's shift into travel now, from trust into travel. I think it was a rude awakening for all of us, just how intense the situation was when the Canada-US border was shut down.
Right.
Any idea what it will take? At what point will the government say, yep, okay, we are going to reopen this? Because we've heard the musings from President Trump that it's going to be open by Easter. We're opening it back up. So what are your thoughts on that? What is it going to take to reopen that border?
Well, first of all, the president now, I think, says that it will be the end of the month. And his chief advisor, and isn't it interesting how chief public health officers or medical officers become heroes during, as they should, as they absolutely should,
Agreed.
because they are on the front lines every day. And Dr. Fauci has become a household word in America.
Yes. And so has Dr. Dina Hinshaw, our provincial medical officer of health.
And Bonnie Henry in British Columbia, and Theresa Tam with the Public Health Agency of Canada. It's interesting, isn't it, Carrie, that so many of them are women?
Yes, is it ever? I appreciate and honor that.
Dr. Fauci has become a household name in America, and people look to him for confidence.
Yes.
People look to him for, if you like, the best information. And I love the way that he so delicately and subtly will take the president's messages and change and reshape them in a way that provides Americans with more accurate information, if you like. And Dr. Fauci has not actually indicated when he thinks America should open up. They are doing the modeling, as everybody does, and looking at what's happening in other countries. And last night at their Sunday press conference in Washington, they were looking for and there were little glimmers of hope in the French data and the Italian data in terms of the leveling off and or flattening the curve and the deaths going down a little bit and so on. And but Dr. Fauci has not indicated when he thinks the peak will be reached. They have told everybody in America this week will be a terrible week, which will tell us, I think, that they're expecting the number of deaths to double even more quickly than they were last week. And the spread will double more quickly than last week. But so we don't know. And I think while the president says, well, I'd like to see baseball season start, or I see no reason why the NFL season can't start on time, Dr. Fauci stands there, and then he comes to the mic, and he takes people through the science, and he takes people through what we don't know, right? And Dr. Tam and others in this country, and Dina Hinshaw and Bonnie Henry and others do the same thing in this country, although they don't have to deal with leaders who are saying, oh, the CFL season should open soon, right? But I think we don't know when borders will reopen. As I say, people will be watching the Chinese situation very carefully. They reopened their borders, and now they may be dealing with a phase 2, right?
Yes, that's right.
People started to travel into China, and now they've got more disease. So I think people will not want to lift the restrictions too soon. They will want to make sure that we are well past the peak before travel is, people may start to go back to work before that within our countries, right? Domestically. But I think in terms of foreign travel, countries will be very cautious, and they may open a border to one country and not another country on the basis of where the stage at which that country is at in dealing with the infectious disease crisis. So we will have to watch that very carefully. And I think that Canada and the United States will make that decision together, because it doesn't really make sense not to, right? You know, I just don't even know how that works.
That's under common sense, but we know that some people interpret common sense very differently. You opened the conversation to travel. I want to talk about that because you sat on the Edmonton International Airport Board for many years, and really I look at the video footage. It's extraordinary to see planes parked. So as a former board member of EIA, once travel resumes, how do you think airports will have to respond? And I mean, what's your personal experience? Do you foresee some more screening checks before we can actually board planes? What's that reality going to look like?
Well, first of all, I think this is a very tough time for the airline industry,
Oh,
and therefore airports, right? The government of Canada has deferred, or maybe, I'm not sure whether deferred or foregone, that's a big difference, obviously, rent payments. So for, I think, up to the next 6 months. So that is a relief for airports in that regard. Hundreds of millions of dollars in rent payments when you add up all the airports that pay rent across the country. So that's a help. But at the end of the day, what you have to have is Canadians or the world feeling confident about traveling again and getting on a plane, right? And that is going to depend on how quickly we get through this disease and bring it to ground, and people feel comfortable leaving home, getting onto a plane where you're sitting beside people you don't know.
Yes.
Some may be wearing masks, some may not be wearing masks, and so on. Some may have a common cold, but we just don't know, right? And people, I think, for some time will be they'll be fragile in terms of thinking, do I want to get on a plane where I don't know the people around me? You know, I suppose maybe if you could drive somewhere, at least it's you and your family or friends, and you know generally their relative health. So I think this is going to be a very hard time for the airline industry. They will come back. Obviously, Air Canada and WestJet will need, and they're looking for support from the government. And you need airlines to move people in and out of the country. They're key to economic activity globally, not only domestically. So we need to make sure that our major airlines survive and come out of this, come out the other side. But I do believe it will take time for airline traffic to return to the levels that we saw, because we're used to living in this global world, right? Without borders, without boundaries.
Well, both you and I were affected by that. We travel lots.
Yeah.
Canceled everything in sight.
Exactly. And I, you know, sometimes I think, well, you know, I should be packing my suitcase and getting ready to go somewhere.
Weren't you supposed to take your grandchildren to Disneyland or something?
Actually, yes. Last week, we were going to be on a Disney cruise out of Port Lauderdale.
Florida. Yes.
Okay. I have never been on a cruise, and I can assure you, Carrie, I am not going to rush, right?
I don't blame you one bit.
I will have no hesitation getting back on planes because they're so important to what I do, and I just fly a lot. But I really seriously will think about going on a cruise. As we've discovered, they're petri dishes for disease.
Agreed.
And I would not want to be stuck with my grandchildren, lovely and wonderful as they are, for 2 weeks with no port to which to dock, right?
I don't blame you one bit. There's zero judgment there.
I think the cruise ship business is going to take a very long time to recover, because people have seen what has happened. And look, I'm not saying there aren't people who won't take a cruise. Of course there will be. But I think the cruise line business is going to, they are going to be one of the hardest hit in the travel hospitality business, in terms of people being just a little skeptical about whether they want to take this chance with their health.
And I want to talk a bit about Alberta now, if we can put our focus there. Oil-driven province, always has been. Oil hovering, I thought, somewhere around, just ballpark, $25 a barrel, if not much lower. What does this mean for our province post-pandemic? Again,
as with the rest of the economy, it's hard to say. Although we went into COVID-19 with a number of big, strong gale force headwinds to start with, right? Because we know really since 2014, the oil industry has not recovered. And we know that we are going to live in a carbon constrained world. That's a given.
Yes.
And we also, and then, so that was the macro picture up until recently, where companies, and I give companies, especially some of the leaders in the oil and gas industry in our country and beyond, they were starting to embrace a carbon constrained world. They were taking on board the fact that their industry 40 years from now is not going to look the way it does today, that they will be doing business differently. I mean, people concede that we will still be using fossil fuels in 2050 or beyond. But we will be using them differently. They will be extracted from the earth differently. They will be refined differently with much less impact on the economy or on the environment, with many fewer GHG, greenhouse gas emissions, and so on. And good companies were already starting to make those investments. And they were at the beginning of that transition from where we were to a new carbon constrained world. And nobody was quite sure what that would look like, but people were experimenting, a lot of research going on, the application of AI, artificial intelligence, and so on. Technology, as in every other area, will drive what the new oil industry looks like in our province and around the world. But then along comes, just as we're dealing with COVID-19, along comes the Saudi-Russian disagreement in terms of production. That was all about production and the fact that the Russians were not living up to their agreement. Russia's part of something called OPEC plus. The Saudis are the big dogs in OPEC. And the Saudis, I think, got a little tired of the Russians not living up to their commitments around production cuts to keep the price at a reasonably stable level. And so the Saudis, I guess, decided they would teach the Russians a lesson. So the Saudis are now producing more oil, I believe, than they have in a long time. And they can ramp up their production very quickly. The Russians are producing more oil. So this agreement, at least for the time being, seems to have fallen apart, which means that the world is awash in oil at a time when, because of COVID-19, the demand side is probably between 25 and 30 million barrels less on a daily basis.
Right.
On a daily basis. And the Russians and the Saudis are producing more oil. America is producing more oil than it ever has. Also, as part of this, you know, it's like a big kind of conspiracy movie in a way. The Saudis want to drive US shale producers out of business, right? That's what, you know, and President Trump is not, and the Saudis and the Russians would like the Americans to agree to a production cut. President Trump is saying, no way, no way. And so consequently, you've got all of this. So demand is down by about 30 million barrels a day because of COVID-19. And people aren't traveling, so you need less jet fuel, and people aren't in their cars, and so on, right? So it's a perfect storm.
It is.
In Alberta, in the oil industry, where we have reasonably high cost oil in terms of production costs to start with. And we don't have the access to markets that we would like, which is why it's important for TMX to get built, why it's important for Keystone to get built. And you saw the province work with TC. I still call them TransCanada. But TC last week with an announcement. TMX is being constructed as we speak. So we will have greater access to markets, which is a good thing. But I do think liquidity, as somebody said, what does the oil and gas, but the oil industry need? liquidity, liquidity, liquidity.
Right.
They need money, right? Most of them are a lot of them. The big companies, yeah, they're hurting, but they will survive. The Suncors, the CNQs, the Imperials, they will continue to do what they're doing, even though their share price has taken a hit, and so on. Major pipeline companies will survive. Medium and small producers, I think that's where the real fear is, that a lot of these companies will not make it because they're in a cash crunch. They do not have liquidity. And that's why I think my guess is that the government of Alberta and the government of Canada, Bill Morneau, the Minister of Finance, are looking at how one could inject greater liquidity into specific industries. The oil industry would be one. The airline industry would be another right now, right? Because they're just basically shut down.
That's right.
So I think that needs to happen. And it's interesting, I am hearing from some in the sector that they do not believe the government, be it provincial or federal, the two will undoubtedly, I think, work together on this, that whatever program is designed should not be to save every company, but should be to save the good companies. The companies that are well managed, the companies that have good reserves, and so on. And it's way above my pay grade to figure out
which companies exactly
are, but it is not above the pay grade of Canada's chartered banks.
Yeah.
They're the ones who provide the liquidity now, who provide the capital to build the projects and so on. And they are in a good position, I would say, with an injection of liquidity from governments, they are in a good position to determine who should survive and who shouldn't.
Okay, and I'm going to wrap up this conversation with this question today. It's been so insightful, but at the beginning of our conversation, you talked about how this whole crisis will change how we do work. I want you to comment a bit about that, and in addition to that, what good will come of this? Please give us a silver lining somewhere.
Well, I think in terms of work, it's too soon to tell, but I am chatting with people, a colleague with whom I work, he's the CEO of a company that does a lot of business in China. They have, from the very beginning of this crisis, been dealing with their places of work around the world, their customers and so on in China and elsewhere. They have been using the kinds of technologies you and I are using, right? It's board in the round, it's Microsoft Teams, it's whatever people choose to use. And what I found interesting was over a month ago, he said, you know, this works just fine. And we are beginning to wonder whether I, as CEO, have to travel to China twice a month, or whether my VPs have to travel to Atlanta or wherever they're going, right? Maybe, in fact, we can do a lot of business that we thought we had to travel for through technology, thereby making better use of our time and also helping the environment, right? And what does that mean? I said at the beginning that I'm one of those people who believes I'm not working unless I'm in the office.
That's right.
Well, I have come to realize all my meetings are now on Zoom, on Microsoft Teams, whatever, FaceTime. And if I can do so much of this from home, maybe I don't have to drive my car downtown every day. Right? Maybe offices, law firms and accounting firms and others. And, you know, people were already starting to do some of this, obviously. But this has accelerated this. And therefore, I think people will have a comfort level coming out of COVID-19 that they didn't have before. And as long as the technology's good, now we've seen with Zoom, right, some hacker issues, but Zoom immediately got on that, right? And in fact, even by the weekend, when friends of mine and I had a Zoom gathering, the security had been enhanced, right? we all had passwords and things like that, right? Which had
Agreed.
not been the case a few days before.
Mm-hmm.
So I think as long as we can trust the online doing business at a distance through whatever devices and systems, I think that people will say, you know, this isn't so bad. This, and you know, the number of people I have talked to who say they're actually more productive at home, which I find interesting, right?
Yes.
But I'm starting to get a hang of that myself, in that I may work differently, I mean, at different times in a way, but it is more productive because I'm here by myself, whereas at the office, somebody comes by and talks, right? Or I get up and get a
Yes.
cup of coffee, or I will go down the hall and ask one of my colleagues a question.
Mhm.
And maybe I didn't really need to go down the hall and ask that question. And 15 minutes later, I come back to my office. Whereas now I think, oh, I could probably figure that out for myself,
Mhm.
right? And so I think there are lots of ways we will do business differently, and therefore maybe become more efficient and maybe help the environment. I think we do, however, need to be careful that we don't continue to isolate ourselves from our good friends. But maybe more of us will work more often at home, not exclusively, of course, but more often from home, but then maybe enjoy more going out and being with our friends, right? And our family. And those times will be more of an occasion and be more meaningful for us. Who knows? I mean, all of this, the psychology of crisis and self-isolation, I think is something that we will all have to work through. I was reading an article from a teacher in Wuhan who, I think it was in The Guardian on the weekend, and he was talking about how it wasn't easy to come out of quarantine, lockdown in Wuhan, and walk on a street or in the park and see people that you had not been able to do for months, right? 3 months, I think, in that case, or maybe 4, with 3, I guess, lockdown. And he was talking about the psychology of re-entering, if you like, the public space. And I think we all will deal with that in our own ways, but I don't think we should be surprised if it takes time to figure out what that looks like and feels like after this is all over. And even the hesitation that I referred to earlier about getting on a plane or whatever, the hesitation perhaps of going out. I hope this doesn't make us more distant from our neighbors, right? I hope it doesn't make us be suspicious of our neighbors and the people with whom we have worked and done business in the past, and running into people on the street and smiling and saying hello and engaging with them and patting a dog. Right?
Yes, I agree.
Right now there are all these questions about should you be,
I know.
someone's dog. Well, maybe not right now. We don't know enough yet. Caution would say probably not. Say, just say hi. But all these things that. But I have to come back to the fact that we are very resilient. Human beings are amazingly resilient. The Queen spoke to that yesterday. I look at her, she's 94 years old.
Yes.
And 1, she looked fantastic yesterday.
She did.
And 2, she looked straight into the camera and spoke with resilience and resolve, calling on all of us to be strong and to care about each other. And I think that is a very important message. And I do believe that even though things will be different and we don't know exactly how, we can come out of this stronger. And we can care about each other more and not take for granted all the blessings that we have as Canadians and living in this world you know, as a Western democracy with all the benefits that we have for ourselves and our children and our grandchildren and so on. Although, I mean, I have noticed that with all the best intentions, we do have a tendency to fall back into our old ways. But maybe if we promise each other, we'll do better. But I do think one of the now, I guess it may depend on your perspective as to whether it's a silver lining. But I think all of us will come to realize that we can live very good, meaningful lives with a lot less.
And on that note, Anne, I'm going to wrap it up because you tied it beautifully with a bow on a high note on as we all search for some type of silver lining. And I appreciate that perspective. As I do this conversation, every time I have an opportunity to sit down with you, I feel like I've taken an Anne McLellan masterclass and I come away with my mind expanded and my heart full and ready to tackle the day. So Anne, allow me to express my deepest gratitude to you for this perspective, for your time, and for living and leading by example as you always do. Thank you so much for stepping into the inner circle today. My gratitude to you.
Thank you. And thank you for being my friend.
Feelings are mutual.